Welcome to the Tennessee Heart Health Network webinar. Our aim is to be your resource for innovative statewide initiatives to improve primary care for all Tennesseans. We hope that you enjoy today's educational program and share it with your colleagues to make a better impact of heart health in Tennessee.
Good morning, everyone, and thank you for joining us in the Learning Collaborative, the last one of the year for the Tennessee Heart Health Network. So today I am super excited to have what I call a friend join us. Kelly is a former registered nurse and former stay-at-home mom, along with her husband. They founded Karis Dental back in 2013, and she began as a part-time and then moved on to full-time in 2015. And Kelly, if I've got any of this wrong, please correct me. Kelly started as a dental office manager and has been the organization's executive director for the past 10 years. In 2021, Kelly spearheaded the expansion of the services into primary care and launched Karis Medical. In 2023, they expanded services to include vision screenings and referrals. Kelly is always thankful for the honor of serving the underserved community and sees this an extension of God's kingdom work, which I love that. She's active at church and loves hiking and walking and spending time with the children and granddaughter. 7 years old. I just heard, I cannot believe that, Kelly. So I would let you, if you don't mind, if for those that you don't know, Dr. Bailey and I were visited Kelly and Karis Health back, I guess, in the summer, and I was so impressed with the organization and what you have been doing that we really wanted to hear more from you and share what you guys are doing with the state. So if you can share a little bit of what you're doing. And I'll let you have the floor.
Okay, well, thank you so much, Gladys, for having me today. And I'm always excited to share about Karis and the work that we do. Like Gladys said, we've been at this since 2013, and it really came about as a result of an unmet needs survey in our county. And at that time, adult dental care was the #1 unmet need. And so they just were asking for help getting something started. So my husband would do extraction clinics and just volunteer and do that. And I would kind of coordinate the care. And we were just kind of just barely just touching the tip of the iceberg as far as like meeting that need, because there were so many people that we couldn't see. And so our vision kind of started to get a little bigger. And thankfully, at the same time, the United Way, who had originally funded us, theirs also expanded, and they wanted us to consider doing it full time. So that was pretty scary, but we prayed a lot about it and decided to just take a leap of faith. And we were able to get a building, renovated for us. And so he left private practice and we started Karis Dental full time, like Gladys said, in 2015. So it was really important for us to create an environment of professionalism, compassion. So when we designed the office, we designed it just like we would a private dental office. And we were able to equip it with all brand new equipment, state of the art. We were digital right away. And it was also very important that we didn't just do extractions. We wanted to do restorations like fillings and crowns. So not just get people out of pain, not just alleviate the infection, but also, restore their smiles and get them back to work and allow them to eat and chew and feel confident. So that has just been a huge blessing because so many people, just don't realize what losing even one tooth can do for your self-esteem. And so it's it's really life-changing to restore a smile of someone that doesn't have one, or is embarrassed when they walk in, they're just walking in like this. Or so we also do a lot of partials and dentures, as you can imagine. Then back, gosh, I guess like 2018, 2019, we kind of did an internal needs survey and noticed that at least 50% of our patients didn't have medical insurance. And, they were walking in with out of control blood pressure, and we weren't able to do dentistry. And then, we'd say, go to your doctor. Well, they didn't have a doctor, and they couldn't afford medication. So we started thinking about, oh, maybe we should expand and start doing some primary medical care. And at the same time, we just kind of say God was working on our physician's heart, because he was wanting to leave the emergency room and wanted to start serving this population. So the United Way knew about the two of us and our thoughts, and kind of put us together, and we collaborated again, and worked during COVID to renovate the building right next door to our dental building, and started Karis Medical in 2021. So that has been an adventure. It's hard to believe it's been 3 years, and we're getting really busy over there as well. You're muted, Gladys.
Sorry, I keep muting myself. I'm sorry. So no, thank you. I love that you're really getting to the bottom of some of the things that we are working as a state. Meeting those social determinants of health, trying to close the loops, and you're meeting the population where they are, and improving quality of life. You're talking about the health, the dental, and getting the teeth, the smiles, and being able to eat. That goes all to those social determinants of health. So, do you guys make collateral referrals? I think you mentioned at one time that part of what you're doing is referrals. How does that referral work? If you
Sure.
don't mind talking about that.
Not at all. So on the dental side, we don't do referrals there. I mean, except for like oral health, oral surgery. We do have some oral surgeons that we partner with, but we're doing most everything else in-house here. The only thing we're not doing is implants. But as far as like, any type of like complicated extraction, or, third wisdom teeth, we're getting those done here. On the medical side, as you can imagine, there's so many needs for referrals for cardiology, urology, ENT. So we partner with Project Access. That is another nonprofit that coordinates specialty care. They do have their own eligibility and screening process that patients go through. And then they partner with physicians in Chattanooga and Cleveland, and the physicians donate their services. So it's a great thing, Project Access, and we couldn't do it without them, because so many of our patients need more than what we can give on the primary care side. We're doing as much as we can, but you have to know your limitations as well.
So a couple of the other things that I would be interested to know then, on those referrals, do you follow those referrals back when they come back? Is there a way that you guys note that and say, oh, okay, they did go for their whatever x-rays or whatever it is that you sent them out for? Do you follow referrals?
Oh,
And
yeah.
if so, how do you track them, if you don't mind sharing?
Right. Oh no, so we actually we have radiology in-house. We have an x-ray machine here. So we're not having to refer out for that, but like for CAT scans or MRIs or
Yeah.
things like that.
Okay.
So we have a great team, our medical assistant, and we have 2 medical assistants and only 1 physician. And so we also have an EMR. So they're just tracking that through Athena Health. And I think, and they have like, binders with, the old-fashioned way as well, waiting for that referral. Hey, I mean, waiting for that result. Hey, we didn't get it back. We need to follow up, that kind of thing. So it's a lot of work, and just keeping up with things and not letting people fall through the cracks.
That is so important too. That's one of the things that we're trying to share the best practices in the state, for those closing the loops, whether you're a huge health system or a small practice. We want to make sure that the patients are getting the care. Not that we're, I know that a lot of the practices will make the referrals, but then what does the patient do? Are they really going through with that referral? Do you
We also,
also?
I also will say that we also
Yeah.
utilize community health workers that are often bilingual. And so we're talking with the patient in their own language, and actually, through our vision program, just recently, we had, 2 patients that were needed to go and just have like the pre-operative things done for cataract surgery. And my community health worker arranged for an Uber, which we paid for. Karis paid for that. Met the person at the physician's office, stayed with them, translated the entire time. I mean, just went above and beyond. And we don't have to do that with every single patient, but when they need it, we're trying to do that for them as well. And so I think that having the bilingual community health workers in your facility is just key.
Love that. Music to my ears. You know that.
Mhm.
So the other question I had, and I would welcome anybody that's on the call. We do have a few people on that. Please, stop and ask. This is very much interactive, and we want to, hear your questions too. But the other question I had for you, Kelly, do you guys also make referrals, for example, to if somebody you notice is lacking uh, resources for food, they have food insecurities or that type of, not just medical. Do you refer out for that? And how do you handle
Yeah.
that?
So we still are doing an internal unmet needs survey with every new patient, and then every patient that rescreens. So we do our rescreen process at least every year. And so they're completing that unmet needs assessment then. Um, Most of the time it's us, giving them a resource list. Like they say, okay, we need clothing, or we need job readiness, and we have a whole resource list, and we are highlighting that. We have it, in Spanish as well, and we're highlighting that and giving that to the patient and letting them do it. Now we don't do a ton of case management because we just don't have the time. But I don't say that we don't do it at all, because just like that community health worker that went, with the patient to the eye doctor, there are oftentimes patients just need that little extra bit of help. And so my staff, they go above and beyond, and they will do that if needed.
I love that. I love that you are really caring for the community and closing those loops, and meeting with the people and you're in that community. Um, I will open it up if it's okay with you. Does anybody have questions for Kelly?
Kelly, I joined a couple minutes late. What areas do you serve?
We are serving Bradley County and then Polk County.
Okay.
So on the dental side, we're not really open to Polk right now because we're at max capacity. But on the medical side, we've been able to open up to Polk County.
Kelly, do you want to put your information about Karis Health in on the chat so everybody has access? Especially, I know I'm seeing some people that are from the Chattanooga, East Tennessee area and I know they would love to have your information.
Absolutely. I think one thing that
Yeah.
that people, might wonder about is just the integration of the dental and the medical. We would like to be under one roof and be able to, share space, share staff, all that kind of good stuff. But it really has been beneficial to have this medical arm and the dental just, hand in hand, and providers working together, because, especially, for heart health in particular, your dental health drastically affects your cardiac health. So, we've really, loved having medical for that reason. And just patients are just so excited they can come over and get free medications and get free x-rays, and you know and it's just a little overwhelming at the services they receive.
So that's what I was going to mention, is that the two, having visited your facility, is that they're two basically small houses, like side by side, so they can go back and forth. And can you talk a little bit about the medication that you provide to the patients that come?
Sure. Oh yeah, so we are a dispensary of hope. I don't know if any of you guys are familiar with that, but when we were opening medical, we were just looking at different medication options, whether it be direct relief, which we also use, or MAPS, or RX outreach. We use those, but we also pay this subscription fee to Dispensary of Hope. And for that, we order medications on a monthly basis. They are basically rounding up surplus meds through the states, and are giving them out to nonprofit clinics like ours, and then we have to turn around and give them to our patients for free. So, but one of the things that's amazing about it is that it also includes insulin. So, I mean, we have, insulin, we have Trulicity, and we are required to give those to the patients for free. So, we give out over $1 million in meds every year. It's just tremendous, and it really, of course, you can imagine. I mean, you guys know it increases patient compliance. It helps our physician know if the patient's actually taking their meds, because we can tell if they got them refilled or not. It's just it's a great program. We've been pretty happy with Dispensary of Hope.
So you mentioned insulin, and of course that's one of my passions, and I see a lot of people with the diabetes programs on the call as well. Do you have a lot of diabetics? What do you do about the diabetics as far as self-management classes? Can you talk a little bit about that?
What our physician spends about 45 minutes with each new patient, and we get them in first to get their labs drawn, so that he knows kind of what's going on before they walk in the door. And he does a ton of one-on-one diabetic instruction, nutrition, exercise, and we also have a medical interpreter that goes in the room with him, because about 70% of our patients are Hispanic. So we're doing that. There's not really a program here in Cleveland that's, teaching. And so we've actually thought about training one of our CMAs to become a diabetic nutritionist, and maybe even have that as a funding source for us, that we offer that to other organizations as well. But haven't taken the steps to do that quite yet. Another thing that we do is we apply for a grant every year, and they supply our diabetic supplies. So brand new diabetic patient gets a monitor, gets the strips, gets the meds for free. And then, we're following up every at 2 weeks, and then getting them back in, of course, to check their A1C. So it's a lot of follow-up, a lot of wraparound care as well. And our CHWs are also calling those patients to make sure they understand how to store that insulin, because they're getting so much information all at one time. So a lot of times some of it's dropped. So
yeah, that's great. So we need to get you connected with more of the diabetes self-management courses that I see Lisa on here, and I see other people that do a lot of the programming for the state.
Yeah, we
So I'll
would love
definitely
that.
need to get you connected with that. All right, so I will open the floor back up to any other questions.
Yeah, this is Lisa from the state. And maybe I missed this if you went over it. So when you have your dental clinic, do you do the blood pressure checks? Like, do you screen for blood pressure? And then what is your follow-up to that? Like, you know, we know everybody's like high stress when they come to the dentist. I mean, so you have to take that into consideration, but what type of screening, and if you do see
Yes,
a number, what's
we check blood pressures anytime we're going to numb a patient. So that's not typical of dental offices, but we started that from the get-go, and it's because of our patient population and their lack of care in a lot of situations. So, you know, if it's very high, of course, we're letting them kind of calm down, trying to, you know, ease their minds, and but if it doesn't come down, I mean, and we let our providers decide, you know, what's the highest it will be before we work on them. But that really led us to start Karis Medical, because we were just finding so many people that were out of control with their blood pressure.
I mean,
So,
this is
go
just
ahead, Lisa.
really, really good to hear. We have a lot of things on the kettle, if you will, at the state level that are coming down the pipe. We don't have them in place now, you know, and just hearing what you're talking about, keep eyes and ears open. There's probably going to be some funding opportunities for both diabetes work as well as like blood pressure measurement and stuff like that. I wish I could tell you it's coming today, but it's coming nonetheless. And by all means, we certainly let our partners know. And it's just nice to hear all the good things you're doing out there, and hopefully we can help you out in some kind of way.
Well, that would be so nice. Thank you. I'll be looking for it.
Lisa's great about sending all that information over, and so if you're not getting it directly from her, we'll send it back out, or we let our Learning Collaborative team, community members, know about all the opportunities as well, whenever we get them.
Yeah, and right now we have some webinars and workshops for ADCES and ADA. If you are looking to have someone, like you said, you were talking about getting them trained. If you wanted to apply for accreditation with an ADA or ADCES, the national organizations, we have like the program coordinator training, so they learn everything you need to know, but we're afraid to ask kind of thing. And we certainly can give you those flyers, that information, because all those trainings, we have them. This is the final year, so your folks can get them done before June, and we'd love to share that information with you.
Oh yeah, I'd love that. If you wouldn't care to send it to Gladys, and maybe she could, or you could send it to me. My stuff is here.
Yeah,
I would appreciate
and I have
that.
it. Yeah, I have it from yeah, I can send it to you, but also Lisa, the latest one, I mean, we get them all, you know, new information all the time. So not just the training, but I'll send it to you, Kelly. I've got it.
Oh,
Okay.
thanks, Gladys.
I've got that email you sent me. Let me go do it right now. I'll let anybody else go while I'm looking for this email from Lisa. Any other questions for Kelly?
Kelly, I know you mentioned y'all utilize community health workers. Is that just in your dental clinics?
No, that's actually they're stationed at our medical clinic, but they, you know, they go out into the community representing, you know, all of us, but they're kind of stationed here at medical.
Mhm. Do they do any, and you may have mentioned this, like I said, I had to hop on a couple minutes late. Do they do any SDOH screenings on y'all's patients?
No, not
Okay.
at this time. Mm-mm.
But you mentioned that you do the unmet needs.
Yes. Well, yes, I mean, yes, but I guess, yeah, definitely. We're just looking at if is there anything else that they need, that we can give them a resource for. So I guess we are. I guess it
Yeah.
just, yeah, just not formally, just we call it something different, but
Yeah.
yes, I guess we are.
I knew you were. Yeah. Just terminology.
Yeah.
Okay. Anybody else? Kelly, I did find that email and send it to you. It's got several attachments that I got from Lisa probably a month or so ago. So
Okay, great. Thank
let
you.
me, yeah, let me know if you have any other questions.
Hey ladies, my name's Nona Kelly and I work with Erlanger, and you were mentioning SDOH. I'm a social worker with them and I work with the Medicare population. And what I'm primarily looking at right now is meeting the SDOH needs of our patients. And one of our case managers told me to jump on here, and I'm glad I did. What can you tell me as far as with us being Erlanger, we don't have a lot of dentistry options, but most of our patients are Medicare. Would they qualify?
Well, so on our dental side, we are only seeing Bradley County residents. Now there's several low cost or lower cost dental, in Chattanooga, but which I can send to you, or I can send it to Gladys. Some in Bradley County, it just depends on their Medicare Advantage plan. So if they have dental insurance through that, then we can't see them. But if they don't, or if it's very little insurance, then we have a program called Smile On 65 Plus that will, I mean, it covers so much of their care, even when we have to charge a patient, $600 for dentures, which is our cost. Smile On 65 Plus it only costs them $100. So it's a great program that's for those elderly patients. But again, if they have a lot of dental coverage, then they don't qualify for it.
Okay, thank you. Yeah, several of our patients are Bradley County.
Okay.
Actually putting a resource list together right now that should pop up through Epic. And I would love to add y'all's information in there if that would be acceptable.
Yeah, absolutely.
And I'd love to see that resource list as well when you guys have it available in Epic.
Yeah, I'd be happy to share that. I need to probably give you like my contact information because like I
Because I'm
said,
seeing Julia's name. That's why I said earlier, hi Julia, but okay.
yeah, so Julia sent it to me. My name's Nona, and Julia can give you my information, or afterward I can get it to you. I don't know how to exactly, but we can work it out.
If you'd like to, you can go ahead and put your name or email address in the chat, and I can
Okay.
grab it from there.
Okay.
I was thinking I had been hacked.
It's funny, yeah. If you don't register yourself, whoever used that registration, it'll pop up. I have calls sometimes with my name popping up like 10 times, so it's all good. Any other questions for Kelly? Okay. So everybody's got Kelly's contact information, and everybody, I think, has my information as well. So if you have any questions that come up after, go ahead. Somebody was saying something. You are welcome to reach back out to one of us. And I guess we'll just have a short call today, but I am very grateful to you, Kelly. I love seeing you again, and being able to connect with you. And I will be visiting the Chattanooga area in the upcoming month, so I'll connect with you again. But thank you for your time today.
Well, thanks for having me, Gladys.
We hope that you've enjoyed today's webinar. For more information and resources, please visit our website, tnhearthealth.org. You can find more webinars under our resources page. You can also follow us on Twitter, LinkedIn, and YouTube. Please let us know if there are any specific topics or speakers that you would like us to present. Lastly, tell anyone you know who would be interested in helping to decrease the burden of cardiovascular diseases in Tennessee and share the webinar. Together we can achieve our goals of managing and preventing heart attacks and strokes for Tennesseans.